Welcome back guys. After discussing about the total body fluids, now in this video let's discuss about the shift in the total body fluid compartments. So how the fluid is going to shift in different conditions and how that shift is going to be shown in a diagrammatic form, that's a Darrow-Yannet diagram. Okay, we'll be discussing about the fluid shift and that fluid shift will be shown in Darrow-Yannet diagram. Okay. So, now the first condition which I want you to know is osmosis. Okay, osmosis. So, what exactly is osmosis? Sir, if you understand osmosis, then it will be very much easy for you to understand how the fluid is going to shift from one compartment to the other compartment. Okay, so osmosis means the movement of the fluid, okay, fluid movement, or the, I should say, it's for easy understanding, movement of water from low osmolarity to high osmolarity. So, from low osmolarity to high osmolarity, most of the students will think substances are going to move from high to low. But here I am talking about the osmosis. In osmosis, I am saying the water is going to move from low osmolarity towards the high osmolarity. First of all, what exactly is osmolarity and who determines the osmolarity? Osmolarity is determined by the solutes. Okay, more the solutes in the fluid, more the solutes, more the osmolarity. Okay, high amount of solutes means high amount of osmolarity, simple like that. Okay, or you can understand something like this. Just take a beaker, you just fill it with pure water. Okay, you just fill it with a pure water, then the osmolarity of that water is going to be 0. There is no osmolarity because it's a pure. When you try to add some solutes into it, you just try to add some solutes into it. Okay. Now, when you are adding solutes into it, the water is getting concentrated, or I can say the water is getting more and more osmolar. It's getting hyperosmolar. So, it's the solutes that determine the osmolarity. Now, try to answer this. Here I am showing you two beakers which are having fluids. Okay, now when I connected these two beakers, okay, I have connected these two beakers, beaker A and beaker B. One is having osmolarity of maybe 100, there is osmolarity 100 here, and there is osmolarity, for example, here 10. Now, fluid is going to shift. Okay, the osmolarity of A is 100, osmolarity of the B is 10. So, fluid will shift from which container to which container? Students will think that the water is going to move from A to B, but no, the water is going to shift from B to A. Because B is having low osmolarity and A is having high osmolarity. So, water always moves towards high osmolarity. Or in a way, I can say that wherever there is high amount of sodium, okay, wherever there is sodium, water moves towards the sodium. Osmolarity is mainly because of the solutes. The main solute is the sodium. So, the sodium is going to drag the water towards itself. Okay. So, that's the point which I want you to know. Having said that, now let's discuss about the different conditions in which, okay, different conditions in which how the fluid shift is going to occur, and that's going to be represented in this Darrow-Yannet diagram. Okay, now in a Darrow-Yannet diagram, see the basic things which I want you to know. First, look at this diagram. This is x-axis and here it is a y-axis. On x-axis, I am talking about the volumes, volume of the fluids, volume of the body fluids. Okay, volume of the total body water or something, ECF, ICF. The volume is discussed on the x-axis. On the y-axis, I am going to discuss about the osmolarity. Okay, osmolarity that is going to be shown on the y-axis. Okay, now my osmolarity, okay, our body osmolarity is going to be somewhere around 300. Okay, my body fluids are having an osmolarity of somewhere around 300. Yeah, ECF, ICF, same thing. You already know here in the total body water, or after the total body water, 2/3 of the total body water is going to be ICF. So here I am showing the ICF. Now, 1/3 of the total body water is going to be ECF, extracellular fluid. Okay, extracellular fluid is going to be here. This is 1/3. Okay, so red is going to be small and the blue is going to be big. So here this is ECF. So in the ECF, you know, ECF is again having 3/4 of the ECF is going to be interstitial fluid and 1/4 is going to be plasma. You know it. Okay, but here I am not going to discuss about that distinction. Okay, so simple, what I want you to know is ECF is just 1/3. Okay, now what is the osmolarity? Somewhere around 300 milliosmoles. The osmolarity is 300 milliosmoles and volume you know it. Okay. Now, having said that, look, what happens, okay, now here I am discussing about the isosmotic changes. Okay, isosmotic changes. Okay, what does I mean by? See, if you lose isotonic fluids out of the body, okay, for example, you are losing isotonic fluids out of the body. When you are going to lose the isotonic fluids out of the body, maybe in a condition called as a diarrhea. Okay, if the patient is suffering with the diarrhea, he is losing fluids. Which fluids is losing? He is going to lose mainly the extracellular fluids. The extracellular fluids are going to be lost out of the body. So now what I want you to know is, see, in our body, intracellular fluids having an osmolarity of 300, extracellular fluids having an osmolarity of 300. Both are having 300, 300. So there is no shift. Usually there is no shift. The fluids are not being shifted from one place to other place, from one compartment to the other compartment. But now what is happening? The patient is going to lose the fluids out of the body. Okay, diarrhea, the patient is continuously losing the fluids out of the body. Okay, he is losing the fluids. Okay. As he is losing the fluids out of the body, now what happens is the extracellular fluids are going to go down. The whatever the fluids that are going out of the diarrhea, that are going out during the diarrhea are the extracellular fluids, not the intracellular fluids. So that's why the extracellular compartment is going to get smaller. Okay, there is contraction of the extracellular compartment. Is there any expansion of the intracellular compartment? No, there is no change with the intracellular compartment on volume wise as well as on the tonicity wise. It is no change. There is no change. Only extracellular fluids are getting contracted. That's it, as simple as that. Okay. So look here in the Darrow-Yannet diagram, you can very clearly see in the diarrhea, the osmotic fluid is lost from the ECF. See, the fluid is going out. So that's why it's shifting the extracellular fluid. See, it is a shifting. Okay. So the extracellular fluid is getting contracted. It was supposed to be this much. It was supposed to be that much big, but it is getting smaller. But there is no fluid shift. Either from intracellular to extracellular or extracellular to intracellular, there is no fluid shift because the fluid which we lost is isotonic fluid. So there is no shift. Okay. So this is the point, number one point which I want you to know. So there is volume contraction. The next condition which I want you to know is, see, if you take isotonic saline into the body, okay, infusion of isotonic sodium chloride. So what does I mean by? Now you are taking, okay, from outside you are taking isotonic fluids. Isotonic fluid means nothing but the saline. My body osmolarity is going to be 300 and whatever the fluid that I am going to intake, that I am going to take into my body is also 300. Okay, so that is 0.9% sodium chloride solution. 0.9% sodium chloride solution is called as normal saline or normal saline. So now what happens if I take saline from outside? Now look at this diagram. See, as I am taking saline from outside, isotonic thing, now the extracellular, see, I am taking the saline into my blood. So extracellular fluids are going to increase. There is no change with the intracellular fluid. Okay, there is no change in the intracellular volume, intracellular fluid volume, and even there is no change in the height. There is no hypertonicity or hypotonicity. There is no change in the tonicity. It's just the extracellular fluids are going to be expanded. Now, in your exams, they will ask you, the patient is having diarrhea. Simple. If the patient is having diarrhea, the extracellular volume is going to become less. If the patient is taking isotonic saline into the body, there will be volume expansion. Okay. So that's the point which I want you to know. So the second condition which I want you to know is, okay, here see in both the conditions there is no change in tonicity. Okay, that's what I want you to know. So that's why isotonic or isosmotic, there is no change. Now, what else I want you to know? See here, you know it, the intracellular fluid, extracellular fluid, 2/3, 1/3, you know all this stuff already. Now, I am going to discuss about those conditions in which my body fluids are getting hyperosmotic. Okay, the conditions in which the body fluids is getting hyperosmotic, you can very clearly see there is increase in the height. On y-axis, the height is increasing. In which conditions? Okay, in which conditions? So the first condition which I want you to know is there is a loss of hypoosmotic fluid. Okay, hypoosmotic fluid from the ECF. Hypoosmotic fluid is going to go out of the body. Okay, hypoosmotic fluid is going out. So in which condition hypoosmotic fluid is going to go out? Is sweating. Okay. So during sweating, if profuse sweating on a hot sunny day, you are having a profuse sweating. So as you are having profuse sweating, what happens? You are losing the fluid out of the body. Okay, you are losing, definitely there will be volume contraction. Definitely volume contraction is going to be there. But not only that, now fluid shift also will occur. See, what exactly is happening is, see, first event which I want you to know is, from your extracellular fluid is going out in the form of sweat. Hypotonic fluid is going out. So hypotonic fluid is going out means relatively more pure fluid is going out in the form of sweat. So what happened to the osmolarity of extracellular fluids? What happened to the osmolarity of extracellular fluid? Extracellular fluid is getting more and more concentrated because the last fluid is hypoosmotic, or the pure fluid is going out. So the extracellular fluid is going to have now more concentration, it is going to have more osmolarity. For example, let me put it this way. Here, sir, I am talking about intracellular fluids. Here I am talking about the extracellular fluids, intracellular, extracellular fluids. Now here it is 300, okay, here it is 300, here also 300, osmolarity is 300, same. Now what is happening? As the patient is losing sweat, sweat is what? Sweat is like a pure fluid, he is losing the pure fluid out. Try to understand in that way. Hypotonic fluid is going out, okay, hypotonic fluid is going out. As you are losing more and more free water, what happened to the concentration here? From 300, it becomes what? It becomes 320. From 300, it becomes 320. Now, what you have done is, you have made the extracellular fluid hyperosmolar. Now, there is hyperosmolarity here. Wherever there is hyperosmolarity, wherever there is sodium, water moves towards the sodium. Water moves towards the sodium. So, from intracellular compartment, water is going to shift. There is a shift now. For the first time, there is shift now from intracellular to extracellular fluid, because extracellular fluids is having hyperosmolarity. As now some amount of water is going to shift. Now as the water, purely water is getting shifted, as a new water is being added, what happens? Now from 320, it becomes 310. As new water came, right? It becomes 310. As there is a loss of fluids from intracellular to extracellular, from intracellular to extracellular, now some fluid is lost, right? Now here also from 300, it becomes 310. So here it becomes 310, here it becomes 310, which means equilibrization. Okay, so there is going to be steady state that's happening now. So now the net fluid loss, the net amount of fluid loss is going to increase. So there will be volume contraction, because from sweat some fluid is lost, right? So definitely volume contraction. Which compartment is going to decrease? It's the intracellular compartment, intracellular fluids. Okay, so extracellular fluids are going down. So intracellular fluids, we have lots and lots of intracellular fluids. So intracellular fluids are shifting to the extracellular fluids to maintain the blood volume. In a simple way you can understand like that. Okay, so water is lost. Which water is lost? Sweat, hypotonic fluid. Okay, so hypoosmotic fluid is lost. So that's why, say at the end of the day, what happens is, intracellular fluid, it was supposed to be from here till here, but it is decreasing. Intracellular fluid is decreasing. Volume contraction. Intracellular fluid is going down. And of course, extracellular fluid is also going out, because sweat loss. Okay, loss of sweat. But at the end of the day, what happened to the tonicity? What happened to the tonicity? See, it is hypertonic. Now it becomes hypertonic. Previously, it was still here. Okay, previously it was still here, that is 300 milliosmoles. Now it becomes little higher. Now it becomes higher, means hyperosmotic. Hyperosmotic. Next, the next condition which I want you to know is, again it's becoming hyperosmotic. Okay, the fluids, the body fluids are becoming hyperosmotic, but there is volume expansion. Okay, there is volume expansion. In which condition, sir? Which condition? Which volume is getting expanded? Is the extracellular. I am mainly going to talk about the extracellular fluids. Okay. Now, if you take high amount of sodium chloride into the body, high amount of sodium chloride, you have taking lots and lots of salt. Okay. If you take lots and lots of salt, what happens? First, as you are taking the salt from the GIT, the salt is going to go into the extracellular fluid. Simple. Extracellular fluid is getting from 300. Okay, Okay, let's put it this way. From 300 it becomes maybe 320. For easy understanding purpose, from 300 it becomes 320. Now what happens, sir? You have made the extracellular fluids hypertonic. There is hypertonic extracellular fluids. So this hypertonic extracellular fluids, what they are doing? They are shifting, see. So they cause the shift from intracellular compartment to the extracellular compartment. From intracellular compartment to extracellular compartment, there is shift. Okay. So at the end of the day, the amount of fluid, whatever is there in the body, is not going out, it's not lost. Simply you have added more solutes into the body. You have added more and more solutes into the body. As you have added more and more solutes, what happened? The osmolarity automatically increases. See, simple, let's put it this way. From outside, you have added salt into the body. So from 300, it becomes 320. Means hyperosmolarity, see, that's why it was supposed to be here. The dotted line was supposed to be here. Here it is 300. Now, it becomes 320 something like that. Now, that allows the shift of the fluid from intracellular compartment to the extracellular compartment. So, as the new fluid is coming, it becomes from 320 as the new fluid is added. As the new fluid is added from the intracellular compartment, from 320 it gets little diluted and it becomes 310. Here also it becomes 310. That's it. Why, you can ask me, why it becomes 310 here? Because fluid is lost, right? You have lost the fluid. So, intracellular fluids are getting concentrated, extracellular fluids are getting concentrated. So, that's why hypertonic, there is shift. There is shift sideways as well as upways. Okay. So, that's why hypertonic shifts. So, what I want you to know, if you add more solutes to the body, there will be volume expansion. There will be volume expansion. Extracellular fluids are going to be expanded. See, the point which I want you to know, there is expansion. Extracellular fluids are getting expanded as water is moving from intracellular compartment to the extracellular compartment. So, this is the reason why we always say taking salt is not good. Okay, when you take lots and lots of salts into your body, what they are doing? They are causing the volume expansion. It's the extracellular fluids. Extracellular fluids are increasing. As the extracellular fluids are going to increase, what happened to the BP? Extracellular fluid is nothing but the blood. So, automatically BP increases. So, that's why taking salts increase the BP. If you take salts, extracellular fluid increases, automatically BP increases. More fluid, more BP. More fluid, more blood volume, more BP, as simple as that. So, that's the point which I want you to know. Now, the next condition in which the body fluids are getting hypoosmotic. Okay, hypoosmotic. Look at here, hypoosmotic. The fluid is getting hypoosmotic. Okay. Now what we are doing? So, the patient is having some disorder, maybe adrenal insufficiency. Okay. So, he is having some medicines or something. He is having adrenal insufficiency. Okay, adrenal hemorrhagic necrosis. Something, he is having some adrenal gland problem. Okay, that's okay. See, adrenal gland normally produces what? Aldosterone. Okay, adrenal gland produces aldosterone, which is a steroid. Aldosterone maintains the sodium levels in the body. Okay, aldosterone helps in sodium reabsorption. Aldosterone helps in sodium reabsorption and maintains the sodium levels in the body. When the patient is having adrenal insufficiency, the patient is going to lose the sodium. So, the sodium is going out of the body. The sodium is going out of the body. Okay. Now, as the sodium is going out of the body from the blood, the sodium which was supposed to be in the blood, now the sodium is going out. So, what happened to the blood? What happened to the extracellular fluid? Now, the extracellular fluid, osmotic, or I should say, the extracellular fluid tonicity is going to come down from 300. It is becoming maybe now 280. It becomes 280. Now, intracellular fluid is 300. There is no change. First, normally in the beginning it is 300. Outside becomes 280. So, automatically fluid is going to move from low osmolarity towards the high osmolarity. As the fluid is shifting from extracellular fluid towards the intracellular fluid, see what is happening to the intracellular fluid. Intracellular fluid volume is expanding. There is expansion of the intracellular fluid, but there is decrease in the extracellular fluids. Extracellular fluids are going to go down. So, 2 points which I want you to know is, in a patient, if they ask you, the patient who is having Eddison's disease or adrenal hemorrhagic necrosis or adrenal insufficiency, okay, Eddison's, that patient is going to lose the extracellular fluids and gain the intracellular fluids. And if you look at the tonicity, the tonicity is going to come down. From 300, it may be coming down to 280 because the patient is losing the sodium out of the body. Simply the patient is losing the sodium out of the body. So tonicity also decreases. Done. Next, volume expansion. Okay, volume expansion with hypotonic nature. Okay, hypotonic nature of the blood. In which condition? See, the patient is now suffering with a condition called as SIADH. What exactly do I mean by SIADH? You know it. SIADH means syndrome of inappropriate antidiuretic hormone synthesis. Okay, the patient is having some cancer. Okay, the patient is having some cancer. This cancer, for example, like small cell carcinoma of lung, small cell cancer of lung, which is also called as a lung, wart cell carcinoma of the lung. So this cancer, what it is producing? It's producing unnecessarily antidiuretic hormone. It's producing antidiuretic hormone. Now you know what is the function of the antidiuretic hormone. The function of the antidiuretic hormone is antidiuretic hormone acts on the nephrons. Okay, antidiuretic hormone acts on the nephrons, on the last part of the nephron. See, like here, antidiuretic hormone is acting. When antidiuretic hormone is acting on its receptors, like V2 receptors, the water reabsorption occurs. The pure water is going to be reabsorbed. So the patient is having continuous water reabsorption, means the water is not going out. The patient is not losing the water out of the body. He is not losing the water out of the body. Whatever you are drinking in a day, definitely you will be drinking 2 to 3 liters of water. So whatever you are drinking, that's not going to come out. As it's not going to come out, the addition of this new water is going to dilute your body fluids. Okay, the addition, again I am repeating, the addition of the water, the pure water from outside is going to dilute your body fluids. So that's why in conditions like SIADH, syndrome of inappropriate antidiuretic hormone synthesis, or in a simple way you can say syndrome of increased ADH. There is a syndrome in which the ADH is getting increased. More ADH means more water reabsorption. Water is not going to go out. Water is going to stay in the body. That water is going to dilute the body fluids. So that's why there is a decrease in the tonicity. From 300 it is coming down to 280. Okay, and as the water is being retained in the body, the water is not going to come out. There is volume expansion, extracellular fluid is increasing as well as the intracellular fluid is also increasing. So if someone asks you in SIADH, there is volume expansion with hypotonicity. And if someone asks you about the adrenal insufficiency, in adrenal insufficiency also there is going to be hypotonicity with volume contraction. With volume contraction, see, if I am talking about the volume contraction, it is the extracellular fluid volume contraction. Okay, don't say, sir, intracellular fluids are increased. I am talking about the extracellular fluids. We always talk about the extracellular fluids. Okay. Okay, adrenal insufficiency, no aldosterone, no sodium reabsorption. Sodium is going to go out of the body. As you are losing more and more sodium out of the body, the osmotic or I should say the osmolarity is going to come down. Okay, and what else we have discussed? We have discussed about the multiple conditions where sometimes the body fluids are going to become hyperosmotic. In 2 conditions I have shown you, where the patient is going to lose the sweat, continuous profuse sweating, as well as taking lots and lots of sodium. Okay, taking lots and lots of sodium. So here in this video I have discussed about the Darrow-Yannet diagram, how the fluid shift is going to occur. Hope the video is helpful. See you in the next video. Thank you.